Of course, the diagnosis of a molar pregnancy is a very distressing time for a woman because not only is there a diagnosis of a miscarriage, but also there's a diagnosis of a disorder that also needs to be followed up and perhaps treated with chemotherapy at some stage. Many women will ask the question, does this affect my further fertility? Will I be able to have another baby? The fertility rates for women after follow-up and after treatment with chemotherapy are excellent. There is no evidence that having had a molar pregnancy before or needing chemotherapy for a molar pregnancy has any effect on women's future fertility. So the answer is yes, it will be very possible to have a baby once follow-up is complete, either with or without the need for chemotherapy. There is no evidence that it affects your chances of having a baby. The only thing we know about combination chemotherapy is that there is some evidence that it may bring menopause forward by about 3 years in later reproductive life, but no effect on fertility. Another question that may be asked is there a chance that this molar pregnancy may recur in the future? The answer is yes. If there's a risk of about 1 in 600 of this molar pregnancy occurring de novo, or from the start, if you've had one, you increase your risk of it happening again to maybe about 1 in 100. For this reason, in any future pregnancy, we advise women to have an early ultrasound to ensure that hopefully, as will happen in 99% of the cases, that she has a normal intrauterine pregnancy. Once that pregnancy is over, for each future pregnancy, we also advise that a woman would have a 6-week postnatal HCG blood test just to make sure that none of the new pregnancies have reactivated any of the old molar cells from previous pregnancies. But this would be very rare.